The Trump administration is proposing cutting roughly a third of the federal health budget, which would mean eliminating dozens of programs and shrinking health agencies. Now, these effects could ricochet through huge institutions like UCLA, Stanford, and UCSF, putting a lot of pressure on the Bay Area economy.
While few institutions are reacting publicly, 3 top researchers are speaking out on their own about the tremendous stakes. ABC 7 News anchor Dan Ashley has the story.
The massive research and hospital system known as UCSF dominates the San Francisco skyline, from Mount Sutro to the shores of Mission Bay. But its impact on the city and the country runs much deeper. The system is the largest public recipient of federal funding from the National Institutes of Health in the nation, more than $800 million in 2024. And the breakthroughs that money has paid for have changed medicine. Breast cancer researcher Dr. Laura Esserman runs one of the most advanced platform trial networks in the country, testing emerging drugs to personalize treatment.
We went from having 19% of women have their tumors go away to now 60%. Our goal is to get to 90%. Dismantling all of this work is not going to get us there.
She's talking about the future of hundreds of millions of dollars in cuts or proposed cuts from the National Institutes of Health and Health and Human Services. It's a concern echoed at universities and medical research centers across the country. And the running list of terminated grants already fall heavily on California. UCLA, almost $110 million, Stanford, nearly $30 million, and UCSF, $23 million, according to an ABC News analysis of data released by the new Department of Government Efficiency, or DOGE. And some in the Bay Area worry about a simmering distrust between the administration and the scientific community, stemming from policy disagreements during the COVID crisis and beyond. UCSF Emeritus Professor Paul Volberding was on the front lines during the politically fraught AIDS epidemic. He now worries about the search for new cures.
It's hurting a lot of people. It's hurting the people that are doing the research. It's hurting the people that are volunteering to be part of the research, and it's hurting all the people that are waiting on the results of the research for the advances that might make.
And the search for those cures is woven into the Bay Area's economy. More than 250,000 jobs in biotech and related sectors, fueled in hubs like UCSF's sprawling campus at Mission Bay in San Francisco. That's where Reg Kelly helped launch QB3. It's a biotech incubator that's turned breakthroughs generated by UC researchers into thriving biotech companies, following in the footsteps of famous startups like Genentech and Chiron. How successful has QB3 been?
Oh, we've been pretty successful. We've made several thousand jobs we've created in the companies we've started and the companies we've helped spin out. We think we've brought in billions in income.
Literally billions.
Literally billions.
UCSF is currently the second largest employer in San Francisco after the city itself. It's estimated that every dollar in federal funding creates more than double that amount in economic activity.
Everyone we're profiling here wanted to talk with us with one goal in mind, to drive home not only the incredible breakthroughs that come through UCSF and other research centers, but also the immense value that they create.
Dr. Esserman also points to payback on the dollar. In a major advance for breast cancer screening, she and her colleagues at UCSF helped pioneer the use of genetic testing to assess risk, creating a much more accurate picture of when and how often women should be screened, and with what technology.
That's a huge driver of cost. These investments in these studies, this is, a $10 or $20 million study that will save $20 billion in screenings. Do you understand the investment? It's like 1,000-fold return on investment.
We don't seem to learn our lesson. Public health is really important. It has to be done seriously. It has to be done at a national level. We have to have good databases so we know who's getting what new diseases. And we've let that fall apart time and again.
You can't quite believe it.
I can't believe it. I think I'm having a nightmare and I'm going to wake up sometime and I say, oh, it was just a bad dream.
While it's hard to know if the cuts outlined reflect a new reality for medical research, the pace so far is certainly sobering. A spreadsheet on the Health and Human Services websites lists the canceled federal grants. The printed document in tiny font now runs 50 pages. And some already see it as a referendum on science, medicine, and where we may be heading in the future.
People need to stop and think about it. Is that what they want to return to? They want to return to a time in the early 1900s when child mortality was so high? I think people need to take a step back and say, what has science brought us?
A word of warning from science. In San Francisco, Dan Ashley, ABC 7 News.